Hello everyone and welcome back to MediInsights. Today we explain Anidulafungin Injection, a powerful Echinocandin antifungal used to treat invasive Candida infections. In the next few minutes I'll cover when it's used, how it works, dosing, common side effects, and practical safety tips you need to know. Stay tuned now. Starting with use of Anidulafungin Injection. Anidulafungin is an intravenous antifungal indicated for Candidemia and other invasive Candida infections in adults, and it is also approved for esophageal candidiasis. Anidulafungin is typically reserved for serious or bloodstream Candida infections or when oral therapy is not appropriate, and clinicians often choose it when resistance or toxicity to other antifungals is a concern. Next, dosage of Anidulafungin injection. For adults with Candidemia or invasive candidiasis, the usual regimen is a single 200 mg IV loading dose on day 1, followed by 100 mg IV once daily thereafter, with total duration guided by clinical response and culture clearance. For esophageal candidiasis, the recommended dosing is a 100 mg IV loading dose on day 1 followed by 50 mg IV once daily, usually continued for at least 14 days and for at least 7 days after symptom resolution. Pediatric dosing from 1 month of age uses weight-based regimens. For example, a 3 mg/kg loading dose not to exceed 200 mg, then 1.5 mg/kg daily, not to exceed 100 mg, with duration based on response. Next, mechanism of action of Anidulafungin injection. Anidulafungin belongs to the Echinocandin class and inhibits the fungal enzyme beta-1,3 D-glucan synthase, which disrupts synthesis of an essential cell wall component and leads to fungal cell death or growth arrest. This mechanism is selective for fungi because mammalian cells lack beta-1,3 D-glucan in their membranes, which helps explain the Echinocandin's targeted antifungal activity. Next, side effects of Anidulafungin injection. Common adverse effects include infusion-related reactions, fever, nausea, vomiting, diarrhea, and changes in liver function tests, and some patients may experience headache or anemia. Serious but less frequent problems reported include clinically significant hepatic abnormalities or hypersensitivity reactions, so clinicians monitor for worsening LFTs and signs of allergy during therapy. Next, important advices for using Anidulafungin injection. No routine dose adjustment is required for patients with any degree of renal impairment, including those on hemodialysis, because renal clearance is negligible. Similarly, no dosing change is required for mild, moderate, or severe hepatic insufficiency because Anidulafungin is not hepatically metabolized, but liver tests should still be checked at baseline and periodically because enzyme elevations have been observed. Always obtain appropriate fungal cultures and, whenever possible, tailor therapy to species identification and susceptibilities. Administer Anidulafungin as an intravenous infusion per local protocol rather than bolus, and avoid combining it with other hepatotoxic drugs without careful monitoring. If you are pregnant, breastfeeding, or have complex comorbidities, discuss risks and benefits with your treating clinician because human data are limited and individual decisions depend on the clinical situation. Thanks for watching this quick guide to Anidulafungin. If this helped you, please subscribe to MediInsights for concise, evidence-based medication guides, and drop questions or your clinical experiences in the comments so we can answer them. Stay safe and always check with your healthcare team.